to say hi to everybody who's joining. I'm Alice Bonner, and I chair the Moving Forward Nursing Home Quality Coalition. I'll say a few words about the coalition, but I also wanted to introduce our director, Isaac Longobardi, who is managing tech and slides and everything else today. So we'll give him no difficult questions for Isaac. We'll handle the difficult questions. But we're very, very glad to have a great panel today. The topic of our coalition conversation today is about piloting a joint surveyor provider training. And this is obviously a hot topic because we sold out. And so we're very glad that everyone joined so far today. I will say, in addition to Jane Carmody and Cheryl Phillips from our generous funder, the John A. Hartford Foundation, we also have quite a few people who are in state government with state survey agencies and other divisions, and we have advocates. I can see we have nursing home residents on the call. We have nursing home owners, operators, and many different professions. So just a very brief overview for those of you who have not been on our calls yet. The Moving Forward Coalition was established about 2.5 years ago, and it was in response to the NASM report, National Academies of Sciences, Engineering, and Medicine. And their report in 2022 was called the National Imperative to Improve Nursing Home Quality. And so people were afraid that all that work was just going to sit on a shelf. And so we were asked to come together with lots of organizations from around the country and to take the 600 pages and prioritize just a handful of the recommendations and then create action plans and then test and promote those action plans. So that's what we're doing right now. We've got a number of pilots that we're doing. We have a pilot in Kansas about addressing resident goals and preferences and priorities. We have a pilot in Connecticut that's addressing strengthening resident councils. Last week, I was down with colleagues in Bethesda, Maryland, and the geriatric workforce enhancement programs are working on registered apprenticeships for CNAs who work in nursing homes. And then we're doing a lot of work with our steering committee as well. We also have, I see we have Nancy Swires on this call and others from our Michigan team, and we have a project on Moving Forward Michigan as well. So with all of that as background, again, what I'd like to do is introduce our three panelists and what each of them are going to speak to today. And then I'm going to turn it over to Doug Pace, who's our first panelist. So Doug Pace, who's joining us from Chicago, is a senior director for long-term and community-based care with the Alzheimer's Association. He's also a licensed nursing home administrator and has done a lot of work in that role. And he's going to do a deep dive into the Coalition Surveyor Training Initiative, its roots in the NASM report that I just mentioned, and how we developed that over a couple of years, and then talk about replicability in other states. We've worked in Michigan, you're going to hear about that, but there's other states that we'd love to involve as well. And then you'll hear from Heather Hosey, who's a registered nurse in the state of Michigan. She's within the Licensing and Regulatory Affairs Group, LARA, in the Bureau of Community and Health Systems. And before her career in the state of Michigan, she worked as a bedside nurse in multiple settings. And so Heather's going to provide an overview of the Michigan survey system, surveyor training. She'll talk about, why Michigan partnered with Moving Forward and the value of the training program. And she'll give us some guidance for other states on how to introduce and improve surveyor continuous education. And then finally, we'll have Lauren Stratton, who's a PhD and Senior Associate Director of Psychosocial Research and Program Evaluation at the Alzheimer's Association. And in that role, Lauren's responsible for oversight of psychosocial research. And she's going to provide an overview of the evaluation, the limitations, and the implications of this work. So with that, I think we're ready to get started. So Isaac, if you're able to pull up the slides for us while you're also admitting people to the call, that'll be great. And we'll move to our speakers.
How does that look to you guys?
We can go back to the previous slide if you want, or we can start there. That's fine. Doug, I think we're up. There you go.
Sure. There you go.
Take it
Thank you,
away.
Alice. Yeah, thanks, Alice, and thanks, Isaacs, and thanks to all of you for being here today. So we can go into the next slide, Isaac. So just to begin, we just want to remind everyone about the NASM report. You know, this report was released in 2022. It really is the most important report on nursing homes since the 1986 IOM report involved improving the quality of care in nursing homes, which was really influential in the passage of OBRA 87, which focused on the importance of honoring residents' goals, preferences, and priorities. But here we are today, 35 years later, and unfortunately, nursing homes are still struggling with transitioning from that staff-directed system to one that really is more person-directed, which is why this report is so important. This report emphasized that the time to act is now, and it's urgent to reform the ways in which care is financed, delivered, and regulated in the U.S. Another little interesting fact around this, just to show you how important this report has become, it's been reported that it's in the top 1% of all reports released by the National Academies of Science, Education, and Medicine. That's pretty amazing. Next slide. So the NASM report focused on 7 goals. The first goal was really looking at comprehensive person-centered care. Goal 2 was looking at the workforce. Goal 3 was looking at transparency and accountability around finances, operations, and ownership. Goal 5 was around the financing of nursing homes. Goal 5 was around a more effective and responsive system of quality assurance. Goal 6 was around enhancing quality measurement and continuous quality improvement. And goal 7 was around health information technology in all nursing homes. And today we're going to focus on goal 5 around designing a more effective and responsive system of quality assurance. Next slide. So the NASM report is 577 pages long, but this graph on page 39 really provides a great overview of the report. The central focus is the resident, who is served by empowered staff in a caring environment that's responsive to their goals, preferences, and priorities. And we must always remember that this is their home. It's not a facility and it's not an institution. So the left side of the graph shows all of the important inputs, which includes the important role of oversight and regulation. But equally as important on the right side is the graph that talks about outcomes and the importance of outcomes and how a dedicated quality improvement is vital to ensuring the quality of care and the quality of life of residents. Next slide. And as Alice mentioned, the Moving Forward Coalition is funded by the John A. Hartford Foundation to advance the 7 goals of the NASM report. And in the first phase of the coalition, the group developed 9 action plans. 2 of those action plans were focused on goal number 5, and today we're discussing the action plan on enhancing surveyor training on person-centered care. Next slide. So Dr. David Stevenson, who's the professor of Vanderbilt, the professor at the Vanderbilt School of Medicine, and I were the co-chairs of this committee, which developed the 2 action plans. Dr. Stevenson also served on the NASM committee that developed the report. The other action plan is focused on designing a targeted nursing home recertification survey, which CMS is already currently examining and working with that committee as well. But this gives you a list of the experts from across a wide range of experience in long-term care that served on the committee that developed the action plan on surveyor training. So this group met for over a year to discuss how best the Moving Forward Coalition in the first phase of funding could work with surveyors in improving the delivery of person-centered care. Next slide. So we look to the 5 recommendations from the NASM report around goal number 5, and we really settled for this committee around recommendation 5B, testing and evaluating strategies that make nursing home quality assurance, both state and federal survey processes, more effective, efficient, and responsive, and that are not only consistent with, but can facilitate person-centered care in nursing homes through state demonstration projects. Next slide. So over the course of the year, The committee developed several potential initiatives that would provide training on how to assess, report, and evaluate how the advancement of nurse-resident-directed living is realized in nursing homes. So within the constructs of the first funded phase of the coalition, the committee decided that a state demonstration project to test and evaluate and enhance surveyor training focused on person-centered care was the most feasible. The committee released an RFP, and the group chose Carmen Bowman to help in the development and training, and Dr. Lauren Stratton from the Alzheimer's Association to lead the evaluation of the training. So many of you may know Carmen. Carmen Bowman is a former state and federal surveyor, the author of several books on culture change, and the owner of Educatoring, which is focused on education for compliance and culture. So over the course of a few months, Alice, Isaac, and I and the committee had conversations with several state agencies to discuss partnering with them on potential training opportunities. And so after several meetings, the Michigan Department of Licensing and Regulatory Affairs was chosen to partner with the Moving Forward Coalition in a spring 2024 event, with 4 webinars following throughout the rest of the year to keep the conversation going. And you'll hear more from Heather about Laura and their work in just a few moments. Next slide. So on April the 9th, the Moving Forward Coalition joined Laura in a joint provider surveyor training in Lansing, Michigan, focused on reconstructing culture change. And you know what was really exciting about this training was that it was open to not only surveyors, but surveyors and providers, and there were over 400 people in attendance. Carmen led a plenary around changing institutional culture, followed by a session on how to individualize care plans for residents to have the highest practicable level of physical, mental, and psychosocial well-being. In addition, the Laura staff developed 2 additional sessions, one in coordination with the Ombudsman, which featured a panelist of residents living in nursing homes, and another session featuring a rural nursing home who is on a journey to rebuild person-centeredness using the Artifacts of Culture Change tool. Then Alice and I closed out the day with a session building on the content from earlier sessions and focusing on emphasizing the importance of leadership in creating a non-institutional community in which lives are nurtured, residents are empowered, and where people want to work. Next slide. So what was the main message of the day? The main message of the day really was quality of life is just as important as quality of care. And again, we know so much of the survey process really is focused around that quality of care piece, which is vitally important, but also emphasizing the fact that quality of life is just as important as well. Next slide. And so for our, what were the 3 main takeaways from that day? So Carmen reminded the group that person-centered care is mandated in the CMS regulations, and that we should shift from institutional to non-institutional language, that we must shift from institutional approaches to focus on each individual, individualized care and care plans that include the person's goals, preferences, and priorities. And we should focus on people's quality of life and highest practical level of mental, physical, and psychosocial well-being. And again, Carmen did a wonderful job of really reminding all of us that this is in the CMS regulations, and it's important that surveyors really have an opportunity to survey nursing homes around these 3 takeaways. So the next slide. So for our last activity of the day, we did a poll and we asked the attendees there, if you were a resident in a nursing home, so what would be important to you? And in less than a minute, we got about 300 responses. And as you can see, things like privacy, food, choices, independence, freedom, those all rose to the top. And what are those? Those are quality of life. That's what people in the room said, either they're providers or surveyors. If they were a resident in a nursing home, this would be important to them. And we thought this was really sort of fascinating results. Next slide. And then finally, just to follow up on that April 9th training, Laura invited the surveyors to participate in 4 additional webinars held over the past few months. Those were focused on first, starting with person-centered approaches, recognizing individuality for people with cognitive changes, Why is that important? Because we know that about 50% of all people living in a nursing home have Alzheimer's or some other form of dementia. The next webinar was focused on leaning into life interests and activity preferences. And important here, not just about group activities, but the importance of individual and group activities. And then the last two were really focused on something that I was really excited to learn more about, and really around sleep, honoring sleep that involves personalized medication paths, and the importance of restoring sleep, national awakening, and the benefits of sleep. So that just gives you a snapshot of how we got this work started, all of the work that the wonderful committee members did in developing this action plan, and then the exciting work that we did in partnering with Michigan around this training. And we hope to be able to do this with many other states, and we will have time for some questions at the end. And now I'm going to turn it over to Heather.
Thank you, Doug. Next slide, please, Isaac. As we mentioned, we're going to be talking a little bit about surveyors and their training in the person-centered care. I know Doug did an overview for us. Next slide, please, Isaac. I wanted to give a quick overview of the Bureau, just so there's an understanding of kind of how our actions fit into the state of Michigan with the nursing homes. So Licensing and Regulatory Affairs houses the Bureau of Community of Health Systems. We have two divisions within that Bureau: the Adult Foster Care and Camps Licensing Division, led by Jake Hallowerts, and then our Health Facility Licensing Permits and Support Division, which oversees the licensure activities of our healthcare providers and the healthcare facilities, and some other areas, which I'll get into in a minute, which I oversee. And then Larry Horvath is our Bureau Director. I did provide a link to our website in case you wanted to check those out later. Some of the resources that are on the website are very valuable. Next slide, please, Isaac. So the Bureau of Community and Health System oversees quite a few different facility types. We state license, nursing homes, hospitals, surgery centers, things like that. I did list beside each provider type the number of beds, the number of facilities licensed in Michigan. And then further down on the page, we also issue certifications to nurse aides and medication aides. Medication aides are growing. Actually, that one is now up to, I believe, 4. Woohoo! We're growing fast. That was a new program in March of this past year in 2024. So slowly growing there. We also oversee the Qualified Interpreter Program, which does the American Sign Language for our deaf, blind, and hard of hearing individuals in Michigan. And then lastly, we issue permits for the nurse aid and medication aids trainers and training programs. Next slide, please, Isaac. I know this is a really busy slide. This is for reference, but I wanted to just list some of the activities that are housed in the health facility licensing permits and supports division. And the highlighted ones I'd like to just point out is our long-term care and non-long-term care state licensing section, as well as our consultative section, which many of the nursing homes and long-term care providers have probably had some interactions with. Next slide, please, Isaac. So getting a little bit more into what Michigan has done to try to have a better relationship and be more consultative with our nursing homes and provide a resource. We created in 2020 the State Licensing Infection Control section, which is now known as our State Licensing Consultative section. This is a pretty unique approach that Michigan took, where we're not in a regulatory sense going into the nursing homes, but more of a consultative support approach. A handful of other states in the United States do this. However, Michigan, as I mentioned, started in about September of 2020, where we put together a team of nurses, dietitians, social workers to go in and work with facilities on things that maybe they might be struggling with. It started out with infection prevention and control. We moved into wound care, fall prevention, and care planning. And coming soon in 2025, we'll be touching on resident rights. which all kind of feeds into some of the work that we've done with the Moving Forward Coalition. The state licensing consultative section, they are different than some of our regulatory groups that go in. We do announced surveys. We set it up with the nursing homes. The goal is to help support education and provide punitive consultation, guidance, and recommendations to our nursing homes, their staff, and we work with some of the residents sometimes too, as far as if they have questions or, help interact with nursing homes and their staff and the residents. They conduct at least one on-site visit per year, more if there's a facility challenged with maybe some regulatory compliance, or they need a visit, maybe they have an outbreak in the facility, will come in upon request as well. And then as we do these over the years, as we've had this team around, they've been really great about working with the facilities to pull in some topics that are based on industry needs, and we continue to, talk to the facilities about what they need and how best we can serve that community. And again, our work with Moving Forward Coalition has really partnered well with this team and what they do, and how we can help keep moving forward with focusing on person-centered care. I did include a link to their website as well if you wanted for resources, hot topics, upcoming events, and a platform for questions and requests. Next slide, please. So I was also asked to kind of compare what is our the consultative section compared to our normal state licensing process, which is, I included the authority and the link to that here, but our typical regulatory surveys are conducted in an unannounced fashion. We come in about once every 3 years, unless there's a waiver obtained. A waiver can be obtained by nursing homes if they are in compliance with CMS. But they may still be surveyed by our state licensing team if we do issue a waiver and they receive the nursing home receives a complaint, or they're struggling with operations in the facility. When we do a survey, we start out with an entrance conference, let the facility know why we're there, do our facility tour, interview some staff and residents, observe care, document review, and then we do an exit conference to really just go over what it is that we observed while we were there, and talk to the facility if they're in compliance, if they're out of compliance, and what the next steps would be. A report's then issued, and then the facility, depending on if they're in compliance or out of compliance, would submit a plan of correction, and potentially a follow-up survey could be conducted if there's things that we need to come on site to verify compliance. Next slide, please. So some of the we know that training and with our surveyors, especially that given that the change in trends and what's recommended is so frequent, how do we train our surveyors? That's been a question that a lot of providers have asked us, and wanted to touch on that briefly about, all 3 of our licensing teams, including the consultative team, they go through an initial training with their team and their managers. We have a training section that also supports their training needs. And then based on the survey team that they're in, there's ongoing training that we participate in. Sometimes it's in the method of webinar, on-site trainings. We work with mentoring experiences, conferences, partnering with stakeholders and experts in the long-term care industry, like Moving Forward Coalition. And then also cross-training with other sections that oversee other licensure of healthcare providers, such as like hospitals, hospices, long-term care, homes for the aged, things like that. Next slide, please. So I know Doug touched on joint provider surveyor training. I just wanted to give a little background and follow up to what he had mentioned. We do hold 2 joint provider surveyor trainings a year, one in the spring and one in the fall, consisting of our staff and our bureau surveyors, as well as the nursing home staff and some of their support people. Sometimes we're lucky enough to get our certified nurse aides and our certified nurse aides, our nurses, our dietitians, social workers sometimes come along as well, which is really great to see when we're able to have that collaboration with the full team. The conference is really intended to be a space for providers to come together with our surveyors, collaborate, learn, brainstorm, talk about what are the best practices in the industry and what's trending and what some of their challenges are. The topics that we select and the speakers that we select are based on our industry needs and requests. One of the topics that we do present on every time we do a joint provider surveyor training is based on the top 10 CMS deficiencies in Michigan. So we try to select a speaker or a topic that would cover that deficiency. And a lot of times we find that many of our speakers and topics have some expertise in one of those deficiencies, and so it fits in really nicely. We do strive to partner with speakers that are experts in the industry, including our long-term care nursing home providers, surveyors. Last spring, we were really excited to have Michigan residents participate and share what they felt were challenges in the industry, what they, what they felt their nursing homes were doing well and what they might have struggled with. We partnered with the ombudsman on that, and that was really great. We had a lot of good feedback on that and others, as well as Moving Forward Coalition, who spoke at the 2024 joint provider. And I know Doug touched on these things that they talked about, so I'm going to jump to the next slide, and then if we have questions, we can come back to that, but I know he briefly mentioned those. So next slide, please. Our partnership with Moving Forward Coalition has been really positive for Michigan. We've really we've heard a lot of good feedback from our nursing home providers that have partnered with them. We've had gained a lot of insight from some things that they know works well and things that they know they've worked on with other states that have really been able to help us to obtain our goals. We wanted to assist nursing home providers and staff, as well as our surveyors, to work together to improve the quality for residents, their lives in nursing homes, as well as the families of the nursing home residents and the staff. Happy staff make it a much nicer environment for our residents. So Moving Forward Coalition really helped us to find some direction on where to start with person-centered care, and allowing our providers and our staff, our survey staff, to reach these goals. We've heard from many of our nursing homes, including at the conference, about the impact of the trainings and the work that Moving Forward Coalition has done to help provide a more positive and uplifting experience for residents and staff in nursing homes. I've noticed that our nursing homes have said, they used to be so task driven and focused on what did we get all of the things done for a resident in a day that is so task oriented versus what does that person or what does that resident need for that day. And so seeing that shift in the culture in Michigan has really been positive. We've heard some great stories from our residents. They've shared that they're able to sleep, eat, live based on their preferences and what they want to do. Not everybody wants to eat at 8 a.m. every day, obviously. So, things like that, little stories that have been shared, it really reinforces to us that what we're trying to do in our partnership with Moving Forward Coalition has created a positive impact on our residents in Michigan. And I know Doug also mentioned this, but just to kind of follow up, we did do 4 sessions after joint provider with our survey staff. And I think those were really impactful. They were a little bit smaller group, but really helped us to see, what could our role be in the nursing homes as far as encouraging and providing resources to increase the, happiness of our residents and helping them to be the center of the care versus the tasks that I just mentioned. Next slide, please. One of the things that I was asked was, how did we engage our surveyors, providers, and also residents sometimes to achieve the success that we're trying to move forward to or move towards? And one of the things that we really try to do at LARA and in BCHS is be more transparent in what our goals are, what we're trying to achieve, so that we can all work towards a common goal. Sometimes that's hard if not everybody knows what they're working towards. So, we really do try to get that message out there. One thing that came really easy for Michigan, I think, is the passion that our Michigan providers have. Our long-term care providers really see the value of their work and are trying to do everything they can to support our residents. Their staff, our surveyors, are also very passionate, and together, I think, working towards these goals, we're really making a big difference in the lives of nursing home residents, the staff, and the culture. And then creativity I mentioned because, so often we get into the track of I've done something one way and this maybe works for us, but does it work the best or is there a better way to do it? So we really encourage our teams to be creative, come to us with other ideas if they have other ideas on how the best approach could be done and what could best benefit the group. And then offering support, making sure we're dedicating time for our surveyors to go through these trainings. They're very, very busy with, trying to go to every facility throughout the year and make sure that we're meeting the needs of the facilities. But we also realize the importance of setting aside this time for training, providing them the tools and the knowledge for success. And our leadership has been really great in supporting these activities. And then lastly, just continuing the mission to continue to grow and continue on this path to allow for us to, keep pulling in what are our challenges and how can we overcome those. And I think that's my last slide, but next slide, please, Isaac. All right, and then I will turn it over to Lauren, I believe is next. Thank you, everyone.
Great, thanks, Heather. So I helped to facilitate the evaluation of the Joint Provider Surveyor training along with this team. So that was my main role. So I'm just going to share some of the results of how we did the evaluation and then also what the results of the evaluation were and then any implications we have from that. So for this evaluation, we found it important as we were doing this training to complete an evaluation on it to really look at the outcomes that were achieved from attending the training, as well as just some satisfaction about more of like the delivery and overall, accessibility and things like that of the survey and, the training as well. So we did this and we collected data from all of the participants that were invited and attended to the training. They were all sent to survey prior to the training. So we sent 3 surveys, and the first one was a pre-survey that was sent right prior to the training, about 10 days before. So this was really to get, that base level line of information prior to receiving this education that they would get at the training. The second survey that they received was a post survey, and this was sent out to them immediately after the training, really trying to pick up some of those, shorter term outcomes that you would gain from attending a training. So we sent that out right after. And then we did also look at a follow-up survey that we sent out 60 days after the training. And this was to see any potential long-term effects of the training as well. And all 3 of these surveys were sent out via email to the participants. And like I said, all participants of the training had the opportunity to take these surveys. Within these surveys, we looked at a few different outcomes. We looked at knowledge, and this was self-reported knowledge. Those questions were really crafted around the content that they would be receiving in the training. As well as we did assess confidence, and an example of this, one of the items we had for this was, I feel able to understand the needs of a person with dementia when they cannot communicate well verbally. So really assessing that confidence in some of these key areas, again, covered in the training. And then we also looked at behavioral intentions and behavioral actions. The behavioral actions are if they have taken these actions prior or up till now. And then the behavioral intentions are if they feel like now with this training, do they feel like they would complete these behaviors moving forward from now? So those were the 4 main areas that we assessed, as well as then, as I had mentioned earlier, we did look at satisfaction as well. And that piece of it was assessed on that post survey immediately after attending the training. Next slide. So to look at some of the evaluation results, first I just wanted to share the number of surveys that we received from our 3 different surveys. So first, for the pre-survey, We got 85 individuals to take that, which was a great number. And then it went up from there. For the post survey, we had 155 individuals that took it. And then for the follow-up, we had 109. So these were great numbers to see. And again, we had the opportunity for all to take it. So it was a really good representation of our participants at the training. I will just note that not everybody took all 3 surveys. So if somebody took the pre-test, they might not have taken a post-test. So the numbers do vary a little bit in that not everybody was completing them across all 3 times. But overall, we had some really great feedback through these surveys.
Lauren, we have a couple of questions in the chat. If I could jump in, just if you want to clarify. So
Sure.
people were asking about whether or not the surveys that you're talking about now, if they're publicly available, or would people need to contact you if they wanted to understand more about the specific questions? And second question is whether or not there were different questions for surveyors and providers.
Great, thank you. Both great questions. First, for the availability of the survey, this is currently not publicly available, but I would be happy to have a follow-up conversation with anybody interested in doing an evaluation such as this. And then Alice and Isaac, we can talk about if it would be beneficial to release this sort of survey or what that would look like. But I'm happy to talk about the setup of this evaluation and what exactly this everything included looked like. And then for the second question, can you remind me of the second question, Alice?
Were the questions different on the surveys for surveyors and providers?
That's right, thank you. Most of them were the same. However, we did have a few extras for surveyors in that area of behavioral intentions and behavioral actions. We had 2 extra questions within each of those that was specific for surveyors and more along the lines of the actions and behaviors that they would be taking away from this compared to other types of providers. But beyond that, the knowledge questions and the confidence questions were the same, as well as the satisfaction questions remained the same. Thank you. Great questions. So then I just want to share a little bit about the descriptive. So these are our the representation of the individuals that we had participating, and this we gathered on the pre-survey. So this represented those folks that took the pre-survey. In terms of role, we had a good variation. We had 55% that were nursing home team members, and then 24% were those surveyors that we were just talking about that had some of those additional questions. And then 20% were other, and this also included ombudsman and other type of positions such as that. So a good variation that was represented at the training as a whole, but also that chose to participate in the survey. And then for length of time in their current role, this again, really, we had good represented, as you can see, across all areas. The highest number was there was 25% that had currently been in their role from 1 to 5 years, 22% 5 to 10 years, and then 22% 15 years plus. So, and you can see from there the others. And then 98% were currently employed full-time as well. And finally, once we then completed our analysis and everything and took a look at all of those outcomes, we had a really exciting outcome to share that participants had significantly improved self-reported knowledge and also confidence scores. And this was looking from that pre-survey to the post-survey in particular. So those 2 survey points, they did have statistically significant improved self-reported knowledge and confidence. So that was great and really meaningful in terms of reflecting that the content that they had really stuck with them in terms of knowledge, and also it was obviously making an impact on their confidence as well. We did look at this then post to follow-up, and we did not have any statistically significant results there, meaning their scores did not continue to improve in that 60-day window. However, what we did see, which is meaningful, is that it did plateau in these 2 areas of knowledge and confidence. So they were really, maintaining those scores across time, which was great to see. And also is important to know that 60 days after the training, their scores aren't going back down again. So seeing that maintenance was also an important piece. And we can go to the next slide. Then we wanted to share a couple highlights from our satisfaction questions. Overall, we had really good response about the satisfaction. We asked them questions about the content itself, as well as also the delivery of the training, and both again received some great feedback. And I'll just read through a couple of these. As you can see, 87% agree that the training gave them important information on individualizing care plans, as well as then in terms of content, again, 89% agreed the training gave them important information on the practical levels of physical, mental, and psychosocial well-being. And then we had 88% agreed training gave them important information on person-directedness. And these three areas we pulled these from like the key topics that we really wanted to be a take-home message. So it's great to see that basically almost 90% were feeling like the training really gave them this information that they were able to take away from the training. And then also more in terms of the delivery, we had 90% agreed the concepts covered in the training were presented in a way that made them understandable. So again, that was important to know that how it was being delivered was understandable and really resonated to the participants at the training.
So Lauren, I'm sorry, we have one more question in the chat
Oh,
already
that's
for
great.
you, but I think it's relevant to some of the things. So you're presenting the evidence and the information that we got from the evaluation. Liza Behrens, who does research on this as well, I know, wanted to know, so what do we as a team think about the return that said that the training of surveyors, that it didn't reflect a change in knowledge at 60 days. I know we talked about this, but you know, I know we talked about sort of refining the survey, and how would we interpret that?
Yeah, that's a great question. And that's why with an outcomes, which I'll touch on the implications, it's so important to choose outcomes that are really reflective of your content that you'll be sharing within the training. So we're really thoughtful about those kind of 4 areas that we added, as well as thinking about in what timeframes that you intend to see change within those areas. So for the knowledge piece, we were excited to see that it was changed on that post-test area, since that was immediately after the training. And that's where we saw that spike in knowledge that then they can take forward. And then also, as I mentioned, that maintenance of the knowledge score was important as well. So it wasn't necessarily going up within that next 60-day window. But again, within that window, they weren't then getting any new information. You know, the training by then had been completed. So it was just that they took what they got, that we saw that increase in that post-test, and then it was maintained over time. I think it was an important implication that we felt and we saw within knowledge, as well as confidence was another one of those more short-term ones that you would want to see immediately and then hopefully maintained over time.
I think that's a good, thank you for answering that. And thanks to Liza for her great questions. I think that the other piece of this that we talked about a lot is the turnover in survey agency teams. Again, variable across states, but in a lot of survey agencies, you know, you can do the training, but, you know, 6 months later, there could be very different, you know, staff members there. So it's just something to keep in mind. I think your questions, Liza, are really good ones, because we want to really keep thinking about this. We want to keep getting better at this. And we want sort of everybody together to be optimizing our knowledge and our skills and attitudes related to this. So anyway, sorry to keep interrupting you, Lauren, but you're obviously getting thinking, so keep going.
That's great. Yes, please feel free to keep asking the questions. These are all great. So then we can go to the next slide. So along these same lines, then I just want to touch on the implications. So again, we saw that we had some great outcomes in terms of knowledge and confidence, and also great overall satisfaction questions as well, and responses. So overall, this evaluation really just indicated a need for this type of content, as you can see by change in outcomes and the positive satisfaction, but also then in this delivery of training as well. It was important that we saw that reflected within our satisfaction information, that they liked not only the content, but the delivery, though, you know, 1-day training that was with the different presenters. Overall, they just had some really good feedback on that. And some future implications for ourselves here on this team, as well as others who are doing a similar type of evaluation for similar trainings or other projects like this. We just had some implications and some learning lessons as we continue, as Alice just said, on how we can continue to strengthen our evaluations moving forward. One is just looking at that continuity of survey respondents across times. Ultimately, it would be wonderful if we could really get some strong cohorts that took all 3 surveys, So just thinking through how to continue to get really good response rate from participants in different ways and encouraging them to not just take one of the surveys, but all three if they would be willing to do so, because that is where you get to see the best change over time. Acknowledging, as Al said, that there within this industry, there are some additional outside factors we can't always control, such as turnover and things like that. Also reflecting on the reasonable timeframes to complete the survey while also reflecting on those intended outcomes. So this was an important part that this team really focused on is when do we expect to see that change? Just as we had talked about with that great question before, when do we expect to see that change within those outcomes? And so when is the best time to send out these surveys based on the training and the content that we're delivering? So that's why we really thought about giving that, 10 days prior to the training, providing that pretest. We wanted to see the immediate post-test as well as then giving it quite that long-term response 60 days after to see what long-term effects were. But that's going to be individualized to each type of training and evaluation going on. And of course, this can always be honed in on and reflected upon to see if any improvements there could be made. This next bullet goes well with that first one, just facilitating in-person surveys if needed or possible. This might just help to, again, increase your numbers of people completing the surveys if it's, right there, right in front of them, whether it's a paper and pencil survey or even, just putting up QR codes prior to the training beginning. And then also once the training has ended at the end of the day, just anything to try to capture more data and information from people while it's top of mind and while you have them there. And then also to ensure that the outcomes are reflective of key training components as well. So this we had very similar to the questions we were just talking about, ensuring that your outcomes are reflective of what you are presenting in a training. So confidence might not be something that everybody wants to measure depending on what is in their training. So I think hitting on knowledge and confidence was really important and obviously a big change. But for us, I think moving forward, we can see if we can refine any of that behavioral actions or behavioral intention, since we didn't see a significantly statistically significant increase in those areas. Perhaps we weren't asking quite the right questions, or it's always just good to take back your evaluation and see if there's any ways within those outcomes that could be changed moving forward. And then I just put a few quotes to end here that were reflected at the end of our survey that we gained from participants, and overall just reflecting the enjoyment and the information that they got was really useful to them. The first one here was that they found it enjoyable, informative, and engaging training, and thank you. Part of the training was a resident panel. That second quote really reflects that the resident panel was awesome, very powerful. And then finally, the information was great, and I will use the principles taught at the Joint Provider Surveyor training. Thank you. So just wanted to end with those positive quotes there.
Thank you so much.
Yeah.
I think that's, yep, we got to discussion. So, well, thank you all so much. I think we're going to come off of the spotlight and we'll all be able to see each other and have a little bit of a discussion. We do have about 10 minutes. I wanted to start by inviting again, I think we have about 13 or 14 people who signed up and are on this call who are from state survey agencies. Either you're a director or you're a senior leader, or maybe you're a surveyor. And I'm just wondering, I think it would be terrific to be able to hear from you, particularly, based on what you've heard from our wonderful panelists today about what we did in Michigan. What do you think about your state? What do you think about your surveyors and your state agency? Is this, and again, this is full transparency. Any comments are good comments, but I know a few of our colleagues who I know are on the call. I see Otis Woods from Wisconsin and Joe Tansey and a few others. And I don't know if you guys would like to just come off of mute and maybe give a few reflections on what you've heard. If you raise your digital hand, then Isaac can unmute you. There's a few people who maybe, oh, I can't tell if people are asking. Okay, Joe Tansey raised her hand. Isaac, we can unmute her.
Yes, good afternoon. So I was really interested in hearing the results and the things that Michigan has done. And there were a lot of things there that I thought, oh, maybe I can't do the whole thing, but I can do this or I can do that to help not only provide more resources and skills for my surveyors, but also to help with the education and the collaboration with communities. Particularly since the pandemic, I think we're all still trying to recover somewhat from that. But particularly from there, I think everybody has become so task oriented that we got to dot these I's, cross these T's, and we forget about, the residents that we are serving. And so this helped bring it back. I thought I can do some of these smaller steps in Colorado where to help remind us all of why we're here, and it's the resident, it's the the individual that that we're here to serve. So thank you.
Well, thank you so much, Joe. And we've spoken to you and your team in Colorado, earlier on with the coalition. I also would say, what you brought out about the importance of the voice of the resident, that is so much a part of what Doug and Carmen and I and our whole team, Heather and the team, we talked about for that entire day. And the reason I chatted in about the QSO memo is that there is sort of a clear, I think, direction in the language from CMS that, to me anyway, sounded a little bit different from some of the older language in a good way. There was just more of a focus on, okay, we really have to talk to residents and we have to look at equity and things. So thank you for saying those things. And I encourage, everybody, if you have not looked at that QSO memo, don't print it. It's like 900 pages, but look at it online. It's very useful. And Otis, we can see you.
Hi, good afternoon, everyone. Thank you all. Thank you for the presentation. I'm impressed by the results and am very interested. I think, Alice, you and I spoke earlier in the campaign as to whether or not Wisconsin had an opportunity, and by virtue of its tremendous workload, we did not. But right now we are actually in communications with Carmen about this program. I don't know if Carmen's on, but we have already spoken once and we'll be following up with her on what we can do. We're also looking at a potential CMP project to look at potentially reestablishing the Culture Change Coalition here in the state. There was one in existence many years ago, but it has changed. It has disappeared. But we are interested, and as we are seeing the work kind of normalize, that I think we may have an opportunity to jump into the fray. From my perspective, and looking at hiring new surveyors, we are seeing a lack of expertise and experience in this area, and I think we look at some of the deficiencies that should be written, but because of that lack of knowledge, lack of advanced training in this area, I think we may be missing some opportunities there. We're not a state that shies away from citing deficiencies, especially serious ones. So so in recognition that, oh, is there something that we're potentially missing? I think this gives us a chance to educate our people on in this area. These are very serious matters, and we pay so much attention to the physical health issues. The psychological health is just of importance, and having additional training on this, I think it will benefit us greatly.
Awesome.
So
Thank you
that's my
so
piece.
much. Yes, thank you. Thank you so much, Otis. And you mentioned a couple of really important points. You mentioned about culture change coalitions, and Kim McRae is she's right in my line of sight. And I know she's done a lot of work on culture change coalitions. I know Linda Kluge is on this call. She's one of the people who's been involved in QIOs and those, groups that are working with nursing homes, particularly now on mental and behavioral health. And Wendy Fox Grage is on this call from Nashby. Some of you work with Wendy and the team. There she is. And Nashby does a lot of in-depth work with multiple states and really, getting down to the actual implementation of a lot of the work that we're talking about here. So I just want to bring this around and say, this is not something, person-centered care planning and learning more about it and implementing the principles. We can't do this alone. It really is a group effort, and we have lots of partners around the table, as we can see on this call today. So I just want to thank everybody. I want to see if anybody else has any questions or would like to make a comment. I know we have Marguerite and Jeanette on the call, who are nursing home residents who do a lot of work with us. There may be other people as well. Thoughts or comments, questions for Heather, for the Michigan State Survey Agency, for Doug?
Alice,
Yes, sir.
I was just going to comment too. I want to give a shout out to the committee that worked on this action plan. It was such a diverse group, and we did have a resident from a nursing home, AG Rhodes in Atlanta. We had a CNA, Rowena Shepherd, who is in a rural Eastern Tennessee nursing home that were so vital to this work. We had Joanne Rader, who many of you know is a culture change champion. We had the nursing home providers represented. We had the ombudsman represented. We have CMS represented. And we really did come up with, several different ways to look at this. And it ended up with this wonderful collaboration with Michigan. But, I think there's ways to not only replicate that, but look at other things. And I will tell you, one of the places that we looked really strongly was the program that Rhode Island did back in 2008, when Dr. David Gifford was the director of the Department of Health. And actually, Dr. David Stevenson, who was my committee co-chair, was the project PI on that. And they just had some tremendous success with that program. And it really was sort of foundational in helping us develop this action plan. But just wanted to say, there's many different opportunities, I think, in how we can work with other states and tailoring something that really meets your needs as well.
That's great, Doug. And we're just, Linda Kluge was just chatting in as well that, this is really great to see what Michigan has done. I also want to point out that Nancy Swires and Michelle Mosia and a few other people from our Moving Forward Michigan team are on this call. And, these things all come back together. The age-friendly health system work, the work with the geriatric workforce enhancement programs and others. So I know we're almost at time here, and I want to give Isaac a chance to also jump in here if there's anything else that he would like to add. But I really want to thank our speakers, Doug, Heather, and Lauren, for giving a great overview. And I think you really got people thinking. And we would love to hear from any states. You don't have to be at the state survey agency. You can be doing any work in any states. If you're interested in this and you want to learn more about it, you just want to, again, get a little bit more in terms of the details, we'd be happy to do that. So Isaac, any last words or housekeeping things or anything else to wrap us up?
Thanks, Allison. Thanks, Doug, Heather, and Lauren for a wonderful presentation. This was truly amazing and just a wonderful project. And I'm really hopeful that folks on this call will get inspired and reach out and want to run this in their own state, either part, all, or something adjacent. We're really excited to work with you all. I will say, if you want to keep learning more about coalition work, we have our next coalition conversation on January 15th, 4 to 5 p.m. That will be looking at our Addressing Residents' Goals, Preferences, and Priorities pilot project with Kansas State University, very adjacent, aligned work, funded by the John A. Hartford Foundation. We're going to be really looking at what's in the resource that they're piloting there, doing a deep dive into that. So maybe you've heard about the project, want to learn more. That's a great session for you. And you can always reach out to Alice and myself at info@movingforwardcoalition.org if you want to have deeper conversations about this stuff, contact the speakers, and get more involved. So thanks, everyone, and thanks to our speakers today.
Yes, and have good holidays, everybody, and we'll see you in January. Thank you so much.
Happy holidays, all.